We're now recording. And Leah, you can get started whenever you're ready talking about Up to Date.
Thank you so much. And thank y'all for joining me, whether it's live or later, people who watch recordings. I am so excited that UNCG libraries and UNCG now have access to UpToDate for clinical and patient education. It's a really exciting tool. I posted this agenda document and a feedback poll into chat already, so hopefully y'all have access to this. My name is Leah Leininger. I am a health sciences librarian here, so I work specifically with a school of nursing and then also nutrition, communication sciences and disorders and genetic counseling, but I also do a lot of interdisciplinary work as well. Um, and I will say that yay, I'm so glad to be here. So I'm gonna try to take the brakes off and just like go. I am interested because I saw in the RSVPs that there were some people who seemed very sort of clinically or healthcare education oriented, but also there were some people who maybe are coming from a place of like other interests, like maybe a graduate student in the LIS program or whatever. So I am curious if you can answer in chat. Are you interested in UpToDate in terms of getting basic medical information written for the general public, like yourself, friends, loved ones? Or are you interested in detailed medical information that's, can be a little bit more, to digest, but written for, very nuanced for clinicians and healthcare educators? And I'm just going to keep a quick eye on this. Okay. So I'm seeing one detailed medical info for clinician. I see we've got a sports medicine person here. Hello. And both. I love that answer. Yes. Okay, that's great. So this goes well with the introduction that I have planned. So I'm going to spend a little time on this agenda, and then I'm going to flip over to the library website and do a demo. So what is UpToDate? It's a database that has really helpful healthcare and patient education, including lab tests. It does have information on medications and interactions with both between medications themselves and also with common nutrition like diet and supplements. And it's got medical calculators, and it has so many different specialties. It's been requested for so many years, and it is very expensive. So just to let y'all know, multiple funding sources were used to pay $68,000 so that we could have access, all UNCG employees and students who have that current iSpartan account have access until May 2028. Will it continue after that? I'm not sure. That depends on two things. One, this vendor, they're kind of notorious for having big inflationary increases. So at the moment, UNCG libraries can't support like huge cost increases. And y'all know this, these are our budget times. And two, can we locate multiple funding lines to the tune of the amount that you see in the agenda? We'll see. Let's enjoy it while we have it. So UpToDate does have a really detailed editorial policy. It is a little bit hidden and it's behind a paywall, so I put a link in the agenda to it. What's the information in UpToDate based on? Like a lot of it is these summaries of healthcare and health conditions. Essentially what they do is they look for the best available medical evidence, and when they're reviewing it, they will follow a hierarchy. So they consider meta-analysis to be weighted have the most weight, and then individual randomized trials, and last, they consider observational studies and unsystematic clinical observations. Many of the summaries, most of the summaries are written by physicians, but if you look at the authors list, you do see some specialists. For instance, I have seen a dietitian in the list of authors for nutrition-related topics, which I think is excellent. There is a lot of information in the summaries. Often you'll see a recommendation area. We'll see that in a few minutes. The recommendations are graded using the capital G grade system, which follows numbers, 1 strongest recommendation to 2 weakest, and also letters. So A, there was very high level evidence found, or C, only low level evidence was found. And summaries are based on reviews of hundreds of peer-reviewed journals and electronic database searches. So here we get to the really exciting kind of the meat of it, which is accessing it. This is a little different than some databases, library databases you might have used before. So yes, you have to use a library link just like any other subscription database, but in addition to a library link and your iSpartan account, you also are required to create an individual account with UpToDate. And once you have that, of course, you can use the database itself online in the website, and then you can even download and activate a mobile app, which is pretty exciting, on up to 2 devices. If you do want to maintain that access in your mobile app, just use the library link every 90 days or so. And there is a handout, like a visual handout, that shows how to do this. So I am going to, let's see if I can get this into chat. Here's a link to it, and I'm going to go to the library homepage now and show you how to get into it. And meanwhile, please feel free to put any questions that you might have or comments into the chat. I know Sam's moderating that, watching
I
that for
made a
me.
comment that to Aaron that we could do a workshop with the athletic trainers on this, and that it would be really cool.
Yeah,
That's all so far.
nice. Okay, I'm raising the roof. I love the idea of athletic trainers like getting in here and really using it. That's excellent. Okay, so UNCG library homepage. I mean, typically I will just type UNCG library in as a web address, and whatever browser I'm in will bring me eventually to this page within 1 or 2 clicks. In order to get to UpToDate, I am going to click into the databases link. And here, of course, we get hundreds of databases are listed. So I'm just going to start typing to search the titles and descriptions of our, of our databases. And I can see it right here. It's also linked on some of our research guides if you use the research guides. So I already have an account, so it should let me write in. If the first time you use this link, the page might look a little bit different for you. You might see a yellow register button. Just click on the register button and create a free account with UpToDate. As you go through that process, it's going to ask you some questions, including what specialty are you in and things like that. So definitely put in your, if you are a healthcare provider or educator, put in your specialty, because there are CMEs, like continuing medical education, available from some professional organizations. It's not universal. For instance, they certainly don't have Medical Library Association, which I feel sad about. But if you set up your specialty as part of your profile, that will help you later on. So after that, typically you just go in through the library link and you get to this landing page. So things that you might see, you'll see your name at the top in the banner. And you can see what you've been searching, bookmarks. Also, you can change the search language if you'd like. The CME right here, I'm not going to click on it at the moment, but you definitely can do that. That is going to take you to an area that will show you the organizations that offer CME. And it also, they call this the CME tracker. So if you've been reading articles in here, I call them articles, like summaries or whatever, and answering the questions, this CME area is kind of a place for you to come where you can access that and get the records of it for you to submit to your organization. And still in the top banner, but in the very kind of far right corner up there, we get the tools, which a couple of them are linked under the search box. So drug interactions, that's where you can just start typing like grapefruit and any medication whatsoever. It will show that there's going to be some kind of interaction, or if you take or if you're curious about supplements and medications, you can put in all kinds of like dietary supplements or what have you. The clinical calculators, it has a lot. I'm just going to point out that they're here. UpToDate pathways, those are decision trees. So they're going to be asking questions of you. And I'll show this super quick, but you can sort it by specialty or alphabetical, or you can just search. So for instance, anesthesiology, like, wow, what in the world? You just click that open and you will be getting some information here. And it gives you kind of a nice diagram, and then it asks you some questions. You start the pathway, and it will guide you through a clinical decision-making process. I am going to click up here in the upper left to go back out of pathways, back to the basic UpToDate, or the UpToDate landing page. And just to point out other things that appear under this, I don't know, hamburger menu or 3 lines menu, whatever you call it. What's new, which is just generally things that have been found that are new from those article and database reviews that they do regularly. There is also a special area called practice changing updates. So, and these are arranged by specialty, or you can search them. There is an area here, just like on the landing page, for patient education. So this, I think, is incredibly valuable to all of us. So I think if you're interested in a topic and maybe it's not your specialty, or if, like me, you are not a healthcare provider, you can learn a lot here. It's information provided at a very basic reading level, but it can be very, very thorough. So, and you can search or you can browse in here. So for instance, I don't know, we could do like adult general health. What do I want to know about, say, genetic testing? The basics. And it does have multiple languages. So it takes me to a patient education version of a summary, and there are navigation links that go down the side column. What is it? What are variants? How does the testing work? So this kind of information is useful for me just as a healthcare consumer, but some of our healthcare students or healthcare educators might like this in terms of sample materials that they might want to look at. And you can see they're related topics as well. If I decide that I want to keep this content, there is a share link up here. It will send a link to this content. Also, there is a print button. And just looking at the other icons across the top, if I really like this topic and I want to keep it bookmarked in my UpToDate, so I can just look at my bookmarks area, I'll just click bookmark. And one of my favorites, fonts. You can make the fonts bigger. And there is a little magnifying glass that is sort of a find in topic. And this will just search the page. I feel like it has a slight advantage over the Control F keyboard command that I would typically use, because it does highlight in the page, and not every browser does that. So, I mean, it's handy. So I'm going to come back out to the UpToDate landing page, and again, super quick with the menu. I'm gonna speed through this a little more. Lab interpretation. So, you know, CBC. I don't know. It has clinical, sort of medically lab tests, and this is where you would look at that information. It also has topics by specialty. So I would definitely point this out to my healthcare providers and educators. So for instance, you know, sports medicine, you can just browse in here and look at various areas that might be interesting to you. And they even put patient education in here as well. So moving on to the searching. Up here in the search box, you can type a symptom, a condition, a medication. It will dip into all the content that we've talked about so far. So I'm going to try, let's see. Yeah, I'll go ahead and Try something timely. I'll try COVID. We're coming up on the season, right? So I type a, a condition, and across the top of the results, it gives me these tabs that try to sort of categorize the content. There's not always content in every category. So, I mean, in this case, I can click on pediatric, and there's a lovely overview of COVID-19 management in children. That's great. That doesn't happen for every single topic that might exist. But, try these tabs anyway. Graphics can be especially useful. For instance, the trainer who talked to me about this when we got it pointed out that nurses really like to type something like AFib as a search. And then when you look in graphics, you can see things like the EEG strips, examples that you could look at. And if you like these graphics, whatever they might be, there are lots of decision trees and charts and graphs and things. According to our license, you can post these into a PowerPoint for your educational presentation, or you could put it in a poster if you're going to a conference or something like that. So I'm going to come back out to COVID-19, and clicking into this summary. It's a lot like the patient education summary that we looked at. And I'm seeing a question. Yes. Okay, yeah, I'll definitely go back to the earlier content. Please keep posting like questions and comments and things like that in chat for sure. I'll circle back around to the pathway. So you can see that when you look at one of these summaries, it's a lot more detailed than the patient education summary. So for instance, at the top, we have authors, and you can click to see more information about them. And you also, I love this information, you get the date of when the last literature review was run on this topic, and when was this summary actually updated. To me, that's a little confusing. If the literature review is current through August 2025, what's going on for the 22nd? Maybe they pulled some information from that exciting and controversial ACIP meeting. I don't know. But let's see. Again, we get kind of navigation down the page for a lot of topics that you might want, including, let's see if they have summary and recommendations here. So you can read down the page or send it to yourself. And if you click on summary and recommendations, somewhere in here, they should have that grade for, here we go. When we look at, for instance, something like therapy, what is the advice of the authors of this specific summary? What are they saying? This is their advice in terms of therapy, and this is the grade that they placed on their recommendation. And of course, if you're interested in things like practice guidelines, I mean, yes, there are society guideline links. I don't feel like this is probably the best way to find guidelines. That's like a whole topic unto itself, but you'll often see guideline links in these summaries. Let me click back. And of course, we get information for patients. And at the top of this page, I would say top right, among the icons, one of the new ones that did not show up in the patient education is reflect on credits for CME. So if you're after some of that continuing education, this is where you would click to answer a few questions after you'd reviewed that topic. So I'm going to pause for just a moment. I see in the chat that somebody was interested in seeing how to get to that decision tree. Are there any other questions at this point? and I'll scoot back and verbally summarize some of what I did. So back. So here is a result, some of the information that comes up from a search for this. And I'm going to go back to the UpToDate landing page. And the decision tree, like that pathway, just the front way, if you want to just look at all of them, click under the 3-line menu in the top right corner, and they're called UpToDate pathways. And this is how you get to them, not from the individual topics, which a lot of those, if there's a related pathway for that description of healthcare or symptom or whatever. But this is sort of, you can browse them by specialty, including, I bet they have, I'm not seeing it. Well, this makes me sad. I don't see sports medicine in here, but I bet you they've got sports medicine topics in here. I see a hand. Yes, sir.
Hi, Leah. Thanks so much. This is really cool. And I put something in chat, and I'm just going to ask her a question. So I'm taking over the conversation. Sorry,
Yeah.
everybody. So I was looking at ankle fractures because obviously being an athletic trainer, I live in that world. And I was following along what you're doing parallel. So you were talking about COVID. I was in ankle fractures. Long answer to this question. When you click on the graphics, I'm looking at a graphic right now. Where is the reference for what they're showing me right here? So if I click graphics, the middle one, the evaluation of children 3 to 16 years, right? That seems very specific, and they had this really cool graphic. But if I want to use this, I want to be able to cite this because they're pulling out data, etc. Do they have these things cited? Am I missing where to click for citation?
They've got it. Click where I've seen it is export to PowerPoint. It might show up in print as well, but let's see, and it brings you back to this. But so my computer's downloading a slide, which is fine, but the graphics that I looked at before had a genuine, decent, I don't know, that's so judgmental, but they had citable information that you could adjust. And I am not seeing that here, which is sad. I mean, we're getting a title, but we're not getting, we're just getting copyrights apply. Okay, I'm going to give you 5 gold stars for finding, maybe it's an outlier, maybe it's just very different from the examples that I checked when I was preparing. So let's see.
I'm actually, the content is accurate. Okay, so I actually was going for it. The content's accurate, but I really want to make sure that it's not just, Dr. T spouting off. I love the fact that everything you've been doing so far is up to date. It's peer reviewed. They give you the links, they give you citations. So I'm not trying to be difficult by any means. I'm certainly not calling you out, Leah. Don't get me wrong here. I just want to make sure I wasn't missing something here.
Yep. So I'm using my friend Google and searching
Google.
how to cite UpToDate. If I were to use the AI summary, I would click through to the original source, but I do want you to know that there is a page from the information provider that talks about citing and referencing UpToDate. So I'm going to put this link into the chat, but also that handout, not handout, the agenda that I made for this. I'll write this question and I will, an example. I mean, they give an example, which is not terrible.
Right.
So, I mean, if there's not an author on the graphic that you want, which I didn't see one, I think you would just go with the rest of this and maybe treat it like group author, or maybe treat it like unauthored, but definitely citing UpToDate in here would be my advice. Does that help?
Yeah, that helps a lot. Thank you so much. Appreciate you.
What else do you have? Because you know what, I get super excited about this, but also I got to remember that the tool is only as useful as, I don't know, as the extent to which it's used. So who has questions? I'm going to open it up for questions right now. There is more that I could show, but also, it's really important to take those questions and talk about the product a little bit informally. So does anybody want to chat anything, or let's see. I'm so sorry, my chat is terrible. It's like all hidden. We have permission to download PowerPoint used in our courses. Yes, very good question. Our licensing includes the ability to download those images and that content into PowerPoint. Yes, for sure. And they try to make that explicit too with the download to PowerPoint kind of feature with the graphics. And I asked the trainer who talked with me, and she said, sure, use it at a conference too. So some people like to go to a conference and they like to have that beautiful graphic on their poster. You're welcome to do that too. Just make sure you create or use their suggested citation. And I see Sam's giving us a reminder about the time. Yay, thank you, Sam. So we're coming up on 11:30, and there is a feedback form for this session. I'm very interested in feedback about this product, about this session, whether you're live in this session or whether you watch it later. So I guess we have time for one more question. I haven't heard from some people a whole lot, so please feel free to type it or ask it. If you ask it, it'll help other people too.
I was just going to say, personally, I've already used it to look at like medicines, because you can use it, the drug interactions. You can say, oh, can I take this one with this one? It's very user friendly.
Yeah, this drug interactions tool is super easy to use and very helpful. And again, you can type just a drug name if you want advanced, if you want not advanced, but if you want very detailed information about a medication that you're taking, or if you're teaching somebody about it, so much information in this thing. You can search by generic name, US or Canadian brand name, and it'll have wild information, including, off-label uses, as well as, the typical adverse reactions and how to administer kind of information. So thank you for pointing out that drug information. That's really useful. And I see in chat that our next webinar in this series.
Yeah, it's not till December, so we have a little break in October and November. And I'll let y'all know if we have anything come up. And also keep in mind, y'all can share this information with your departments. Like, I mean, I know Erin because we work together in kinesiology, but if you think that the worksheet, the sheet that Leah shared to set up an account, get the mobile app, etc. I and like Erin, I'm happy to come and talk to Ken faculty or MSAT students or anything about this as well. I think it's a really good. I'm glad we have it for. I hope we have it a long time, but I'm glad we have it for now. So, any other questions? I want to be sensitive of y'all's time as we're at 11:32. Okay, well, thank you, Leah. This was super helpful as always. Be on the lookout over the next couple of days for the link to all the recording stuff. But y'all have the chat now in your teams. I think that's how it works. And definitely follow up if you have any questions. And thanks again, Leah. Have a great week, everyone. It's Tuesday. We're doing it.
Thank you, everyone.
Bye, y'all.
Bye. You're welcome. Thank you so much. Mm. Okay. Whew. It was good to see you. Thank you so much for coming.